Good evening once again. Today is our 1556th day of continuous webinar. Thank you all the participants for joining with us. Today's our guest is Dr. UTTARESHWAR PACHEGAONKAR. He's MD in Homeopathy, Director of Sri Aurobindo Center for Homeopathy, Pondicherry, and ex-homeopathic medical officer, Municipal Clinic, Ambajogai, and GATE for PhD for Homeopathy in Maharashtra University, and Chief Investigator of Extramural Clinical Research Project on Evaluation of Homeopathic Treatment in Keloid in collaboration with JIPMER. And today's our topic is tissue-based pathology in homeopathy. Sir, you are welcome to our session.
Yeah.
You're welcome, sir. Thank you. Now you can start your session.
So, good evening, everybody. See, basically, we as a homeopath, we always look at the totality of the individual. Now, whenever we have some patient in front of us, our goal is to understand the patient into whole totality, and that holistic approach is the distinguishing feature of homeopathy. See, it is very easy to say that it is totality of symptoms, means all symptoms together. But no, actually, we need to derive the conceptual image of the whole totality of the patient with the whole evolution. And then our task is not to diagnose the disease at tissue level, but our task is to have a simillimum which will fit into the present case. Now, there are various levels of being. And when we call that being as an individual, see, each cell functions almost independently, but at the same time, so many cells together, they comprise to form a tissue. And many tissues together in close network they work, and they form an organ. And many organs in network they work, they form a system. And in many systems together they work to form the whole body. But at the same time, this body is again animated by the vital force. Without animation, body can't be called as living individual. And wonderful definition, like description of this vital force, Hanuman has given in our 9th aphorism in Organon, that in the healthy condition of the man, the spiritual vital force, the dynamis that animates the material body, rules with unbounded sway and retains all parts of organism in admirable, harmonious, vital operation as regards to both sensations and functions, so that our indwelling reason-gifted mind can freely employ this living, healthy instrument for the higher purpose of life. See, the wonderful meaning here is that our higher purpose of life has to be achieved, and to achieve this, our reason-gifted mind, this is the peculiarity of human race, that it has a reason-gifted mind. This mind can employ the animated body, the vital force animating the body for achieving the higher purpose of life. So that means we just can't separate like mind, body, this, it is all just one unit. The mind governing the animated body for achievement. So here, when WHO defines health, we as homeopath, we always look at this type of definition of health, where when we are treating the person, we say that we are empowering that individual more and more to achieve this higher purpose of life. And therefore, at tissue level, at pathology level, if the person is sick, sometimes we can define that pathology also as a part of health. For example, see inflammation. If some organ is inflamed, we understand that this inflammation is what we call defense getting roused against some antigen. It can be any negative dynamics. And if our defense is roused at tissue level in the form of inflammation, that is sign of health. So whenever there is antigen and our system reacts efficiently with wonderful defense, we can call it as a health. So therefore, we have to understand this phenomena at tissue and pathology level. Even in our Bonius method, what we call it grand generalization, where each component of the individual, whatever layer it is, each component of the individual is representing that individual to some extent. Each cell, each tissue or each organ, wherever there is pathology, definitely that indicates that the whole individual is sick. And therefore, when we as homeopaths sit in front of some patient, when that patient is being treated, that is our target, we have to understand that patient is again part of the same universe. And even as a physician, I'm also part of the same universe. So one component of the universe is sick, and that sickness has to be rectified or eradicated. And I, as a physician, will be instrument, because finally what happens, I am also part of the same universe. The patient in front of me also is part of the same universe. So indirectly, I am healing myself. And with this attitude, when we sit in front of patient, we have to understand exactly what is our target and what are the means to understand the patient. First thing I'll tell you that tissue level pathology is the easiest thing to understand for us. It is a concrete thing because we have seen. See, the best example will be our provings. See, we have seen the provings, original provings. Each prover has not proved each symptom. Some provers have prominently proved some symptoms, and other provers of the same drug have varied symptoms. So you don't expect that patient in front of you will not develop each and every symptom of the drug. For example, see if it is phosphorus. Now phosphorus has thousands of symptoms. At the same time, each prover is not proving each symptom which we attribute to phosphorus. So depending upon the individual susceptibility, the provers have proved the remedies. Same way, each phosphorus patient will not have all symptoms of phosphorus. So many times we get only tissue level aspects or the body corporate level aspects, in the natural disorder, and where the mental symptoms are not evident, there we have to depend on pathology, especially when we get one-sided cases. See, for skin disease or eczema, where the paucity of generalities and other symptoms are not there, then in such cases, in one-sided cases, we have to depend on tissue level pathology. Initially also, I have seen one example I shall give you, which will make you more clear. I remember in 1978, I had a case which was having discarded by medical college, telling that we can't do anything, prognosis is very bad. They had already tried 18 blood transfusion. It was a case of alcoholic liver cirrhosis. And when that case came to me, absolutely, the patient was bedridden. He couldn't be brought in my clinic also. So I examined the patient in their own car. I had to go out in the outskirts of the clinic and see the patient in the car itself. And that time I remember they were all explained about the prognosis and they were all frustrated. Just as the last trial, they had brought him directly from medical college to my clinic. And there, that time, if you all remember, this Dr. Wilmer Swab had one specific hipafungin. That was a combination of Chelidonium, Cardus, and Chionanthus. And that hipafungin was given for 1 month with one biochemic combination as biofungin. Absolutely, because the patients were not in mental frame of giving totality. They were telling just these are the papers, on this basis you give the medicine. And that hipafungin and biofungin, when it was given, he did recover. His ascites was all right, his liver cirrhosis parameters all disappeared. And after 1.5 months, he came walking in my clinic. So definitely, sometimes these tissue-based prescriptions do help us. I remember one more case where one retired, actually he was not retired, but he had taken VRS from the job. He was a retired inspector of police and he was highly diabetic. And he developed diabetic foot, that wet gangrene in his foot, and they wanted to amputate it. And he said, no, I won't live without my limb. I don't want to be here in the world with amputated limb. So I would prefer to die. I won't go for amputation. And his son, one veterinarian, he thought, why not try homeopathy? And again, this person was admitted in one friend's nursing home, general physician, and one surgeon was attending. And it was in 1984. I was hardly 25, 26 years of age. And I did attend, of course, they were aware of the prognosis. So nothing, and they said nothing doing. We are trying conservatively, whatever can happen. And that time, I just gave them calendula, symphytum, these tinctures for local irrigation. And I told debris you don't remove, just go on irrigating it. And internally, I gave sickle core and all these remedies to enhance the blood supply. Those days, this sonography and color Dopplers, they were not available. And when I gave these tinctures, the surgeon came there to dress the wound in his routine round, and he told one homeopath, a quack is coming from 90 kilometers and advising us for such type of dressing. It is not fair, and we should take our own conscience here and work. And they were discussing, the patient told, sorry, both of you go to some other room and discuss my case. Then they told, no, yes, this serious thing we should not discuss in front of patient. So sorry that again he called them. See, I'm not annoyed with your discussion about my seriousness of disease and all. I'm annoyed with your type of English you are speaking. You are good doctors and you're not speaking proper English. And then when I went for my second visit, the physician told me that your patient is so, much irritated and all. He got irritated with our English and not worried about his disease. This gave me the clue. And can you imagine what remedy I must have given on this basis? Arsenicum album, because that bites the spoon, so much irritable. He is not worried about his diabetic foot and gangrene. And these doctors who are treating him, he is telling that you don't speak good English and you go to other room and discuss this, not in front of me. On this basis, generally, I'm the last person to give arsenicum album so easily, because many times in higher potencies, when vitality doesn't match, it works like euthanasia. This is also known. But they're looking at this mindset of the person, so fastidious, what we call golden-headed cane. And I gave him arsenicum album 1M as a second prescription. And again, local tissue-based remedies. I gave symphytum and echinacea and calendula mother tinctures for local irrigation. And I'll tell you, the whole thing reversed. His even great toe also was conserved and he could walk about. Okay. So here, that is what I have seen, that these tissue-based prescriptions, many times when we can't take the totality in depth, definitely it works. And then I started working on this. See, finally, our senior homeopaths would remember that Dr. Piri Smith, when he came to India in World Congress, and there he was talking about the concept of drainage remedies. There he was telling, even if some indicated remedies are available and you give, you have to look, make background or the platform for better action of these remedies. So sometimes if the constitution is not ready to receive it, because finally what happens when we talk of totality of symptoms, what does it mean? The totality which is pervading today, or the symptoms which were there for this month or this year or this life of the patient. See, totality is such a broad phenomenon. And therefore, even if the remedy is matching, there we know that if you give directly some antisoric remedies where the platform is not created, there would be horrible aggravations. There will be horrible aggravations. So here it is good idea to have tissue-based drainage remedies, or some people call it satellite remedies, or some people may call them organ remedies. And if these organ remedies are given, they prepare wonderful platform for the action of constitutional remedies, which are selected on the basis of totality with the finest tuning of the patient with the remedy. So this way, if we have approach, I have seen that you don't get aggravations. At the same time, you get very quick results. And many times, if you are not able to get the totality to treat the person on constitutional basis, definitely there would be relief. Some people might call it palliation, suppression. But at the same time, I'll tell you, if the indicators are there for action of organ remedies, which are based on the tissue pathology, definitely the person improves, he gains the confidence, and at the same time, he responds very well to the remedies. See, you remember that Kent has wonderfully explained the what we call the trios. Even Nash has elaborated it. For example, Colocin causticum staphysaria, or in malarial fever, Kent has described Epitorium sapia and Natromone. Now here also wonderful, only the corporeal, the body symptoms they have given there. That Epitorium passes into the phase of sapia, and sapia passes into the phase of Natromone in most of the cases. And in this following well, this thing, the physical and mental, both the criteria are there. Another example which opened my eyes is genus epidemicus. See, in epidemics, right from Hanuman's time, and even we have seen that in acute illnesses, especially these epidemics, many people, whatever their constitution, they do suffer from similar symptoms. And even Hanuman has allowed that we just take initial few cases in details and work out a genus epidemicus, and that genus epidemicus works in every affected individual. And not only that, we have seen that these remedies which are worked as genus epidemicus, they help even in prophylaxis of these remedies. I remember way back in 1986, our remote beat district in Maharashtra had a type of viral hepatitis. Almost 400 cases were admitted in government hospital, 3 wards in medical college, and 3 wards in district place. Even WHO authorities came to study. And there we have seen, we studied initially few cases, and there we worked out the remedies. And the first day, 1 or 2 days, the remedy symptoms would be Merck. Then the next 2-3 days, it would be Natrumsul, and the person would end up into hepato, like swelling and white stools and all classical chelidonium. And when we worked out these remedies, fortunately, I was medical officer in municipal clinic, and there we started giving this cycle as preventive. And many people, many families did not get it. Sometimes my allopathic friends used to ridicule that we used to give medorinum for our what there people call it Mumbai eye, because that conjunctivitis viral infection comes from Mumbai. In south, in Pondicherry, we call it Madras eye. So same way, this conjunctivitis epidemic was there, and there we gave medorinum 200 as a prophylactic for people, and they were telling how can you give? And you are asking question whether the left eye is affected or that eye is affected. All that they were ridiculing, and after witnessing the results, even the ophthalmic surgeons also started advising people to go for homeopathic remedies. So based on only sometimes diagnosis like that epidemic disease, we do give these remedies on the basis of pathology. So this is what I have seen. And many times what happens, the what we call interpretation of mentals. If the mentals are available, nothing like that. One dose can work magic. But if it is not available, definitely you can take tissue level symptoms as means to prescribe. Now, I have seen one thing that even at tissue level, depending upon the individual's miasmatic background, the pathology will vary. And definitely by studying the tissue level pathology, you can diagnose the which is the dominant miasm in that person and what are the we can say fundamental miasms. So by studying the tissue level responses, we can come to the remedies. Like I have seen one case was brought to me in busy hours of clinic, and this lady around 70 by age, she developed a deep, actually arterial thrombosis. The thrombus was in main femoral artery, and when the color Doppler was taken and it was a threatened gangrene, they said this lady can't stand the complete amputation of lower limb. And they said, no, you can't do anything in this. And when she was being taken home by one ambulance, the driver told, why don't you try homeopathy? And imagine the lady with such a thrombus, complete occlusion of femoral artery, and she came with tremendous pain. And that time the case taking also was not possible. But looking at the pathology, the color Doppler report and all, I started giving her our Sickle cord, and then internally symphytum 2x, ginkgo biloba 2x, and locally also we started spraying the calendula and symphytum on her foot. And can you imagine, we could achieve within 10 days without antibiotics, everything, the line of demarcation appeared. See, we have even the medical college, our local medical college people told that line of demarcation is the phenomena we have seen only in theory. Now we see the just pictures. Now it is out of question to get case with line of demarcation or making it dry gangrene from wet gangrene. And we could achieve it only with pathology based remedies. So this is how we can definitely have approach. Of course, it is not the replacement for our constitutional approach. Please try to understand this. We are not telling that we will be able to replace that whole theory of constitution and mental symptom, but definitely the nexus between mind and body is there. The mind is the prime thing, and mind governs the whole phenomena. But at the same time, we can understand the patient. If the patient is, say, not able to give you symptoms, if the attendants are not able to give the symptoms, definitely the tissue-based approach or the pathology-based approach will do wonderful work. We have seen, like many times here, like injuries, routinely people give arnica for blunt injuries. But here what we have seen, I remember one person I told, like, you have fallen in the well, and since then you are not all right. And we have given you arnica so many times and you are not getting helped. And then that time we just deeply asked, and the person told, see, I am a good swimmer. I won't have any problem by falling in the well with water in it. But at the same time, the very act of falling, and that gave me fear. And with that fear, I suffered. And here we gave aconite. See, tissue-based remedy, arnica did not work. But I gave aconite napellus on the basis of mind because the person had sudden fear, and this fear had given rise to symptoms. So there the remedy based on the mental symptom worked and not at the tissue level. So here we, as a homeopathic physician, we have to understand all these phenomena, and there we should know that what aspect of the person is available. Like definitely if there is a case where mind and body symptoms are matching, wonderful, nothing like that, and one single medicine will work. I remember one case of psoriasis. We as homeopaths, we can take psoriasis cases, but definitely, honestly, we are scared of taking those cases because they take pretty long time. And the area where I used to practice, it is a remote place where everyone knows everyone, not like cosmopolitan city. And one psoriasis patient, when he came to me, I did not take it for 1 month. I was telling you, no, you just try. It's a hardly fresh case, hardly 2 months. You got psoriatic lesions, and you come after a while. Our homeopathy may take few years, and he insisted upon he being a homeopath because he was convinced by his allopathic doctor that there is no cure. And the way he was approaching, he came, and incidentally, what happened? I used to visit one nearby city on Sundays for practice. And there he came. Then I told, new case, it takes pretty long time. You come to my headquarters. And he said, no, it being Sunday, you are traveling on Sunday. I can't come to your place on other working days because I run jewelry shop, which I can't leave on my staff, and I can't come. So 3 consecutive Sundays he tried, and he came. Absolutely without psoriasis, he did not have any complaint. Absolutely one-sided complaint, apparently. But the way he approached, and then finally, after 3 weeks, he came with our district judge for convincing me that he will be. And when I told the judge that, see, I would be taking the case, but I am afraid that he may not continue it till it is cured because it may take some time. And when judge told, no, no, he is fully convinced and he will continue. And then I took the case. Generally, I would never prescribe lycopodium as an opening remedy. But exceptionally, in this case, I gave him lycopodium 30 OD for 1 month. And after that, almost like 25 years, he did not have any other remedy, just Saclac for 3 to 4 months, and he recovered. Until date, there has been no relapse. And the mental symptom was like lycopodium, so much of perseverance. He did not go for any allopathic treatment for 3 weeks, and he persisted. And some corporeal symptom, just vague, that 4 o'clock bloating of abdomen, very sweet tongue thing, but very firm outside. And that remedy worked. So I have seen some remedies just without any repetition, they give wonderful results. So same way, like we were working on keloid. We have done research in collaboration with JIPMER. Can you imagine, in keloid, we had 105 cases which were treated for more than 2 years. And wonderful results. We have nowhere in the world there is case where there is complete regression of keloid pathology. And we could achieve it. And this was done. And can you imagine the main remedy? There were, of course, series of remedies. In 105 cases, we gave almost 88 remedies with different occasions, not with one remedy, series of remedies. As and when acute symptoms would come, we would change the remedy. And one common phenomena, that zincum metallicum, we could arrive at, that was giving the best results in some of the cases. And we worked on the basis of pathology. Can you imagine, in keloid, what happens in wound healing, where there is ulceration, and that wound healing is in 4 phases. Phase of congestion, then the collagen bundles are formed, And finally, the last stage of scarring is fourth phase, what we call maturing. Once the actually replacement is done, the scar should mature. That means the process should stop. When the filling is done, everything achieved, why the scarring should continue? But in keloids, this final phase of maturing, the fourth phase, is not controlled. Body can't inhibit it. And therefore, it is a uncontrolled reaction, uncontrolled action. And zincum has this, that zincum reacts, but that reaction cannot be controlled. And with this logic, we gave and it wonderfully worked. But of course, at the same time, some, the constitutional remedies did work. I think I did not have this slide just now. But one case of post-herpetic neuralgia the person had, and he had developed keloids on those herpetic ulcers, which were healed. And we were treating him as a keloid patient. His post-herpetic neuralgia subsided, and all his keloid lesions, they regressed to almost skin level, And this regression again was achieved with this initially giving him zincum metallicum, and of course we gave him remedies like arsenicum, albumin, ranunculus bulbosus for post-herpetic neuralgia. But at even tissue level, there was complete regression. So this way, we have to find out the nexus of the remedies, like how zincum will work at tissue level and how zincum will work at mind level. And definitely, some patients will have zincum metallicum at tissue level. It may not be evident at mind level, whereas there are patients where the zincum metallicum can be evident at mind level. And therefore, both ways we can practice. So therefore, we don't know what aspect of the remedy will be evident in that place. So we can't form that. I have seen some people, they say even calendula or injury remedies also you can't prescribe by diagnosis that it is injury. No, you have to substantiate it with mental symptoms. I agree. But in each and every case, maybe you will not be able to access those mental aspects. And sometimes we find it very difficult to interpret and then arrive at the remedy. So sometimes what I do is I generally follow the boning essence method, where I narrow down to the range of remedies on the basis of concrete symptoms, physical symptoms, tissue level symptoms, pathology symptoms, and then differentiate those remedies on the basis of mentals. That goes easier for us. We don't call it, we may call it eliminating symptom or whatever, but tissue level pathology, which is just concrete, will definitely help. I remember one case of eczema at Glabella here. And this eczema was allergy to that tinkle. In Maharashtra, they apply tilak, kumkum. And that allergy, almost 6 months, the remedies did not help. There was constant progression and aggravation was there. And one fine day, someone told that there was a call from lady to have an appointment, but I forgot to ask the name. And the boy told that, oh, I just took the names, who would take the appointment on phone. And that boy told, yes, yes. She laughed like that. Laugh, unnecessary. And on this basis, I gave Nux moscata, Moscus. Moscus, this was the remedy that helped, only on the basis of undue laugh. So similarly, at tissue level, I was fighting for absolutely, I was thinking it is one-sided, but this undue laugh, I never realized. Another case example I shall give you. I had a case, middle-aged man around 30, 32, and he came with one symptom that he used to yawn, and while yawning, his jaw used to get dislocated, get stuck, and he was not able to close it. And then orthopedicians trained him to retrieve it. It's all right. He was already then he came for homeopathy. Honestly speaking, I couldn't get any remedy for him. I was trying on the basis of his bowels and sleep and dreams and all, and I gave him causticum was the remedy based on his mentals. And then after 3 months of all these remedies, he came. I asked him, "How are you now?" "No, but I can't tell you whether I'm cured or not." And then I said, "Well, why?" Then he said, "I did not yawn for last 2 weeks, and therefore I don't know whether it gets dislocated or not." Then I realized that why he should yawn every day and get things dislocated. So that means that excessive yawning was a symptom which I did not realize. And then causticum had that symptom, and the person was relieved. So many times we may miss even some symptoms, which are generalities, but through pathology, definitely we will be able to arrive at a remedy. Finally, you know that the even provings are like this, what we call clinical provings. What are those clinical provings? Where the remedy may not have that symptom. Remedy in the Materia Medica book may not have that symptom, but when that remedy is given to the patient and this symptom disappears in more than 2 cases, that means that symptom is added as a clinical proving in that remedy. So like that, we have many tissue level symptoms where the remedies can be attributed for the cure. I remember one case of malignancy. Actually, this lady it was in 1981-82. That time, the investigative techniques were not that much advanced in mofusile area. And this lady, Bal Vidwa, they call it, a childhood widow, we can call it. At the age of 11, she got married, and at the age of 13, her husband passed away. And typical traditional family, they did not go for marriage. And she was running a tailoring institute, and she developed a tumor in the breast, and they thought that it is just a fibroadenoma, and they removed it, and after resection they realized that it was malignant. And this surgical scar, this wound was not healing. And then she came for homeopathy, and we started giving our traditional remedies. Of course, she had the report, biopsy report, and all. And 2 years, it took 2 years to treat her, and her whole symptomatology was there. And she was dressing, she was running the tailoring institute. And after 2 years of running the institute, this ulceration in the breast healed. And after 2 years, we presented this case to the group of doctors, and there was our surgeon, and one surgeon told, "My God, who has done this mastectomy so nicely?" See, the nature had done mastectomy. The whole breast got eroded, it was ulcerated, discarded, and then it got healed, and she survived till she retired for 30 years with homeopathy. So tissue level remedy actions are wonderful, but if we are able to combine both the constitutional, the mentals, and tissue pathology, nothing like that, no match for it, and we can achieve wonderful cures. But at the same time, if you are not able to get even remedies for pathology, you can go on mentals, and definitely it works. At the same time, give on the basis of pathology, it will work, but at some time you would need intervention with mental symptoms. So we should achieve this balance, that achieve the cure at pathology level, and at the same time give remedies based on mentals, so that the remedies can complete and no reversal will be there, no relapse will be there. In COVID cases, like see, we have experience so much in COVID, the whole population of India was given arsenicum album. Arsenicum album as a preventive. And then after that, the second wave came. But what we have seen, that we gave camphor as an initial remedy. The camphor we selected because in COVID, the economy of the person was not taking cognizance. This virus was allowed to just barge in and go into the system and start working. And this camphor was the initial symptom where it used to rouse the vitality, it used to induce the reactivity of the person. And then we worked that some cases where the body is going into hyper mode. It is the exaggerated response, and therefore, the zinc came. So camphor, where there was absolutely no response, the virus was allowed to go there. The person used to go in hypoxia. The oxygen saturation used to fall down, and even then, person was not having any symptom. They just used to collapse without any warning, and therefore we gave camphor. Then we gave zincum metallicum, and that sudden onset, otherwise healthy sudden onset, in some cases, aconite came into picture, and then came the ferrum phos embryonia. But at the same time, we have seen that these viral fevers, the Eupytorium perfoliatum, and then sapien nitromo, these were the 8 remedies which have done wonderful work in curative as well as preventive. We have seen in some cases where if the person is on oxygen, you start giving camphor and the oxygen requirement would come down. They would be without oxygen. We have seen within 24 hours, there would be improvement, and many people have been helped based on this tissue level interpretation. So as a homeopath, we have to go for such type of work. Of course, a lot of scope is there for research in this work. We have to substantiate it with a lot of research, but at the same time, we should be open to it. I have seen many cases where now all the people have started realizing that there are limitations for every system. So best is we should have all equipments with us, so we can go on sensations, we can go on mentals, we can go on tissue level behavior, we can go on advanced pathologies, we can go on even past history, and something like that, we can have wonderful results. I think one way it would be not proper, so we can have some question answers if it is fine with you. So, are there some questions from the?
Yes, Dr. Hariharan sir, please unmute. Hariharan sir, you can unmute now, please.
Okay. Doctor, your narration is very good. You have a lot of experience, and you see. I will open my video, then I can.
Yes, that's
Okay.
good. Yeah.
Okay. Carries. Okay, video not came. Okay. Now it is okay. Dear doctor, your narration is very good, and I am really appreciating you. Your experience is so much. See, one of my doubt regarding is that you said about a carcinoma case treated a young lady, and she is not married for a lot for a long time, and she happened to be a carcinoma of the breast. And which medicine you prescribed? That I am not here.
Right. See, what happens initially when she came, she had that surgical wound and which was not healing. So that time, only on the basis of that, I gave her staphysagria and hypericum and local dressing with calendula. That's all. And
Okay.
later on, we added echinacea, mother tincture, and symphytum in the mixture for local dressing.
Okay. See.
And then I gave carcinosine when the reports, and actually she showed me the reports after 15 days, that biopsy report. So earlier, initially, it was a surgical wound with not healing with first intention. And that way I gave her Stepsagrin, Hypericum and local calendula dressing. And she did not develop fever or anything that time because it was just oozing little bit. That's all.
Okay.
And of course, that time she was given a lot of antibiotics also. There was no question of having pus or some generalized infection symptoms. So I did not go for pyrogenum or arnica like things.
Okay. Doctor, see, another doubt is that what will be the conflict of that lady? See, which causes this disease? Which conflict?
See, that actually we did not work it out. Okay, what was cause behind she getting carcinoma at the age of 30, 31? Got no primaries, and there are a lot of hypothetical things are there. They told primaries or who did not get conception, they also develop carcinoma and all those. So we did not go into that aspect of us.
See, why can't you think about suppression of the her sexual desire, and it causes a malignancy?
I understand. I understand, but again, it will be too hypothetical because what happens, sometimes I have seen some ladies who can resolve all these things without getting suppression. Not necessarily, see, if someone doesn't indulge into sex, doesn't mean that he has suppression. We can't presume it. That's the difficulty. See, I work in Sri Aurobindo Ashram. I have seen many couples who are married but never indulge into sex. So we can't call it as sex suppressed and therefore leading to carcinoma. It will be too hypothetical.
See, the reason may be every disease, chronic diseases, there may be one conflict, big conflict, deep conflict will be there. So that I asked you such a question.
See, I understand that. Yeah. We did think of this. Rather, we were working for baggages she carried from her ancestors also, like inheritance and all that. It can,
Okay.
like her very strict family, father was very much disciplined. I know, but sometimes, they also are okay with it. Not necessarily that otherwise this carcinosin we did give on the basis of diagnosis. But then, like we say, whether strict parents are there under suppression and all that, carcinosin can be the remedy. But all this literature started coming after 1995.
Sir, do you think that carcinosin is a preventive remedy for carcinoma?
Not necessarily. Not necessarily. Carcinosin we have given even without any history of malignancy in the family.
Okay. Which will be the miasmatic remedy to prevent the carcinoma, doctor? Can you any idea for that?
See, it can be mixed. All these three miasm mixed together,
Yes.
I would take it definitely. But like if it is not ulcerating spontaneously, see, this case was opened. Actually, it should have been psychotic miasm because this growth did not open by itself, not ulcerated. It was induced ulcer.
Okay.
So
Okay.
it can
Doctor,
be psychotic domination in that. And
see, a lot of doctors are waiting for you, but I have a lot of doubt because you have a lot of experience. From your class, I understood that you have a lot of experience. So I have a lot of questions, but I am now withdrawing and see a lot of doctors are raised their hand. Okay, thank you very much.
Thank you, Dr. Hariharan. Dr. Indranil, you can unmute yourself and ask question to Dr. Uttareshwar. Please unmute.
Yeah, can you hear me?
yeah.
Yes, sir.
Okay. Sir, thanks for a good explanation and presentation. Only one query is that in all one-sided diseases or chronic diseases, every time it is very difficult to find the conflict of the patient. So is there any questionnaire protocol to bring out the conflict of the mind? So can you explain it?
Yes. See, there is, of course, as I told you, that one-sided disease, if I find it one-sided, the other physician may probe some symptoms easily. So it is actually our own phase, we can call it, or the situation. But definitely we can work out remedies based on questionnaire, but there can't be broad questionnaire. We have tried questionnaire, say for bowels. For a very simple example, bowel habit. In bowel habit, I tell you, we can have wonderful, explanation sometimes spontaneously coming from the patient. Well, I'll tell you one example where the person said, I get clear bowels, no problem, stools are well formed. And then one fine day, means maybe it was like third or fourth sitting, and the lady said, see, in the morning, it's a very funny phenomenon that when I'm awakened and I just leave my bed and start walking, I get pressure for my stools. And then that time I can't control. And then she said, I shared the bathroom with my mother. In our 2 bedrooms, there is one bathroom common to us. So she ascertains from the bed itself on awakening whether the bathroom is free, or she will call mother, are you in the bathroom or not? Bathroom is free, then she will get up. And with this, I could guess that, causticum is the remedy where the walking, facilitates passing stools, or then you can't control it while walking. And if the person, while lying, she can wait for even half an hour. But the moment she gets up and starts walking, and I'll tell you, she was a case of arthritis.
Okay.
Osteoarthritis, and causticum did help both. The sensation also went, and even arthritis was there.
It covers both. Very true. Very
So
true.
till then we were thinking it is osteoarthritis one-sided, no symptom. But this way we get the symptoms.
Okay. So we have to correlate them, you mean?
Exactly. Each area we don't know like where you will get the symptoms. Correct. It may not be abnormal, but wonderful. And there are people who tell that the moment I sit on commode, the sensation ceases. And I'm just stand up and walk, I get pressure. So sometimes you get some symptoms like this.
Okay. Thank you, sir, for that explanation. Yeah.
Thank you, Dr. Indranil. Now we have 7 more minutes. If any participants have questions, you can ask. Dr. Nishikant is he's from your family's doctor?
Yeah, he's my son.
Oh, okay.
Yeah.
I
He's
was
a
the
homeopath, yeah.
surname. Dr. Hariharan have more questions, I think.
Sir,
So you can ask.
sir, do you have any experience regarding, say, neurofibroma? It is a young boy. He is about 10 years, having neurofibroma, very minute dose. See, any experience for
See, I
neurofibroma?
have varied experience. I have many cases. And one lecturer I'm teaching for last 20 years. And he has multiple neurofibroma on face. Like cluster or symmetrical. And I'm treating him. And just in 20 years, I could achieve hardly 20% regression. But the person is happy because he was actually informed by the physicians earlier that it just progresses for the whole life and we have no control. And he's so happy that it is under control.
Very good.
Absolutely.
Very good.
Whereas I have a case where that girl was being treated and she got married and she had children, and at the age of some 38, 39, she developed some sort of a paresis in lower limb. And they told this neurofibroma has grown in the spinal column, invading the spinal cord. And that is bordering, and that has to be resected. And then there we couldn't convince the family to not to go for surgery. Otherwise, they told, can you guarantee that she won't get paralyzed? And this neurofibroma was operated, and again there was a relapse, and she became worse in 1 year. Miserable it is. She was fine for almost 12, 13 years with our medicines, and it was operated. One neurofibroma was operated there at the crucial spinal cord, and she is miserable. So both types, we can check the program. Of course,
Of course, doctor. Because see, the child, and now I am treating that boy, I know what happened is that, yes, minute nodules I have seen, and such nodules are now it is blackened in color. blackened in color. See, what was the result of that? What is the inference it shows, doctor? In a way, in your opinion, what is
That's what I'm telling here. See, we try to convince them. See, how we try to convince is that is what I'm telling. See, we convince them that this neurofibroma is not inserted by someone else. Your body has developed it. And body has definitely developed not because of any reason. That body has a mechanism to quarantine the disease. Like in computer language, if virus can be eradicated, it's fine. But if it can't be eradicated, then the antivirus package quarantines it. So same way your body is quarantining some phenomena at a safer location in the form of neurofibroma. So we are treating the system which alone can reverse it. But it can reverse it only when it has a respite. That there is no other malady, urgent malady to attend, then body will attend it. And then it will reverse. So hypothetically, it may not reverse for the whole life, but if it is not progressing for the whole life, that is cure. After all, what happens? We can't remove all poisons from the humanity. We can
Okay.
make them dormant.
Very correct.
And
Very
so
good.
this
Very
way,
good.
we
Very good.
convince them and they're convinced. And I have seen, see, I have cases which are following for last 30, 35 years and with full gratitude that we are fine only because of homeopathy, in spite of no cure for it. So called.
Very good. Very good. Okay,
Yes.
doctor. Congratulations. Your inference is very correct. Okay.
Thank you, Dr. Hariharan. Actually, no other participants have question, I think. We have 2 more minutes. Now it is the time to move to the Malayalam section. Actually, it's a wonderful session. 105 cases treated with 88 different homeopathic medicine. And you have mentioned about Syncomet gave good result, right?
Yes.
Can you say about that?
No, see, why I said this, that, we did not get any book or literature which is mentioning that zincum met can
Okay.
remedy.
That's
We have like thiocinamide, a very common remedy for it. Then we have schirinum and on the base of graphitis, acid floor, silicea. These are the remedies which are supposed to be well known. But it was only Dr. Kopikar who said, like when we met in one seminar and when we were discussing, it was our ongoing project. It was he who has said that I have used zincum, met, and millicum. Otherwise, nowhere there was mentioned. So in that context, I said we found it like.
Okay. I was confused.
Our interpretation was on tissues, where in the maturing phase, body cannot control it. It is a favorable action, but it should be controlled when the purpose is over. And in zincum met cannot do that. Exactly, that was the logic we applied in trying to work out why it has helped, like that.
Doctor, what is the potency usually you are using?
So
Syncomet.
that we were very particular. If there are some mentals or generals matching, we gave 1M, otherwise 30.
Only 30.
Yes. If it is only on the basis of keloid, only 30. On pathology.
Okay, thank you, sir. Thank you. Now we are Dr. Ram Parvesha. Sir, you can say a vote of thanks to Dr. Uttareshwar. Please.
Thank you, Dr. Anjali, and everyone. Good evening. Very, very thanks and congratulations, Senior Most Dr. Uttareshwar Sarji. Very nice presentation, excellent session.
Thank you.
Tissue and pathology. Angle of treatment. There are 3 angles of treatment. Symptomological angle, pathological angle, and miasmatical angle. So, symptomological angle. There are 2 types of disease, acute and chronic. Acute disease, easily treatment, symptomological angle. And chronic diseases, without miasmatical angle treatment, not curative way of treatment. Pathological angle is very difficult treatment. So It is very thanks, Dr. Uttareshwar Sarji, behalf of IFPH. Very thanks.
Thank you.
Presentation. Very thanks. Thank you.
Thank you, Dr. Ram Parvesh Shah. Thank you, Dr. Uttareshwar. And now we are moving to Malayalam session. Thank you all the participants of the English session. See you same time tomorrow. Bye bye. Good night. Love you all.